This is LFS Explained.
By Thea and Bella.
What is it? LFS is a genetic disorder that causes different kinds of cancer. This includes breast cancer, soft tissue sarcoma, osteosarcoma, and many, many more. First case found in 1969, and it's a wide range of cancers. This genetic disorder is inherited, and you have a much, much higher risk of getting cancer. Half of the people are diagnosed before the age of 30. Pictures of tumors, cancer cells, and brain cancer. Sources.
How is it diagnosed? Needs genetic testing and criteria to be even tested. Needs person and family with it. Needs to have a sarcoma before age 45. Family history of cancer before age 15.
How is it tested? It is tested from a blood sample. DNA is isolated from the cell using a method like DNA sequencing. They look for the TP53 gene if it has a mutation or if it's isolated and they'll only have one. Sources. What is it like to have leishmania? You will never know if a headache is a brain tumor or not. You will not know if a cough is just a cough or if it's lung cancer.
Women have to get breast scans every month to see if they have breast cancer. They have to go through many major surgeries to remove tumors and cancer. Some need organ transplants. It is very hard to get. There's a long wait list.
Chemotherapy is very hard on the body by having it not just kill the cancer cells, but kill cells in general. Not to mention how you can get sick, you are much more tired than normal, and you can be in the hospital a lot more, either because of weakened immune system or because of the chemo causing problems.
Everyday things are hard because people can live in fear and won't want to travel far in case something happens or if they get sick.
How many cases? Leishmania syndrome occurs in 1 to 5,000 or to 1 in 20,000 people worldwide
400 families have been diagnosed with LFS.
since it's been discovered. 5 facts.
Women with LFS have almost 100% chance of getting breast cancer.
Nearly half the people diagnosed with this disorder have cancer before the age of 40.
Compared to the genetic disorders, it is relatively uncommon.
People with leishmania gene mutation have a 90% chance of getting cancer. Unless you're a woman, then you have almost a 100% chance.
More than 14 associated cancers with LFS.
Who does it affect?
This genetic disorder affects guys and girls. It affects the whole body. It is caused by the absence or mutation of the TP53 gene. People who have this disorder will struggle with it for the rest of their life. It will usually affect the whole family.
TP53 gene. How do you get it? Normally, every cell has 2 copies of each gene, one from the mother and one from the father. LFS follows in an autosomal dominant inherit pattern. Mutation happens on only one out of the 2 copies of the TP53 gene, causing LFS. When a person inherits a mutation, they get it from at least one of their parents. Again, LFS means that you have a mutation or an absence of one of the TP53 genes. Symptoms.
Effects from chemo are very not good.
There are many effects of chemo, as we've said in the video before this.
Core cancers from LFS. Soft tissue sarcoma
Soft tissue
is very uncommon.
Soft tissue sarcoma is a rare type of cancer that can affect children and adults. It can develop in muscle, tendons, fat, limbs, blood cells. Some treatments include chemotherapy, surgery, and targeted treatment therapies, and immune therapy.
Osteosarcoma affects teenagers. It is a kind of bone cancer that affects teenagers especially. Treatments are surgery, chemotherapy, targeted therapies, and cryoablation. Cryoablation uses liquid nitrogen to freeze cancer cells.
Breast cancer. People who are female at birth have Leo for Manny have a very high chance of getting this type of cancer, almost 100%, because breast cancer sucks. Treatment includes radiation, chemotherapy, immunotherapy.
Gliomas, including glioblastoma, this is a form of brain cancer that affects adults. It can be treated with chemotherapy or targeted therapy. Targeted therapy focuses on proteins and genes that help cancer grow.
Chloroblastoma. It is a brain cancer that usually affects children. Treatments are chemotherapy and surgery to remove the tumors.
Medulloblastoma usually affects young children. These are rare, fast-growing brain tumors that usually affect young children. Treatments include chemotherapy and surgery.
Neuroblastoma is a rare type of cancer that forms in nerve tissue, usually affecting children under the age of 5. Treatments are chemotherapy, surgery, and immunotherapy. Adrenosarcoma. It is a type of cancer that forms around people's outer layer of the adrenal glands. Treatment includes chemotherapy and surgery.
Acute myeloid leukemia is a blood cancer that starts in people's bone marrow. Treatments include chemotherapy, targeted therapies, and monoclonal antibody therapies. Monoclonal antibody therapy is a type of immunotherapy.
Prognosis. You will most likely die from cancer associated with this disorder.
Treatment options. To treat this disorder, you treat as they come. You cannot treat them once you discover you have LFS. You have to wait till you get some sort of cancer, and then you treat the cancer as you get it.
Chemo, of course, is awful, as we said throughout the beginning of the video. And there are so many things that go with it, but you can also do radiation. Some disorders have different treatment options, like the immunotherapies and the one that which freezes cancer cells using liquid nitrogen. You can also go into clinical trials, which can help, but also could make things worse.
Places to donate. The first link, when you donate, it helps lives with LFS. It helps to go to research to learn more about LFS. It helps get information to the families struggling with LFS.
Next place you can donate is livinglfs.org. Donations allow us to connect with LFS patients, to give them resources, and to make sure that they know that they are not alone, making LFS more known to the general public.